And now, please welcome Temie Giwa-Tubosun, founder and CEO, LifeBank.
Hi, everybody. Five years ago, I was right on this stage. At that time, I was pitching an idea that I thought could really help save women across Africa. You see, let's say there's a nurse in a primary health center in Lagos, Nigeria. It's 3 a.m. This nurse has just delivered the most gorgeous little girl. A few hours later, the mom starts bleeding. This nurse is not quite sure where she's gonna get the blood, the medical supplies she needs to save this mother's life. This problem is a large problem, and it exists across Africa. The lack of access to blood really causes significant amount of mortality. But it's a simple problem. So 5 years ago, my co-founder and I sat together, and we came up with this idea. And the idea is to match supply to demand. While I was pitching LifeBank at Solve in 2017, we were in 2 cities, Lagos and Abuja. We were moving just blood. Today, with the support of this incredible community, we now operate across 11 cities in Nigeria, Kenya, and Ethiopia. And we match supply to the demand for blood, medical oxygen, medical consumables, PPE, and medical equipment. We've had incredible support and partnerships from people that are part of this community, from MSD for Mothers to Johnson & Johnson Foundation, to Skoll Foundation, and to the Gates Foundation. We've built incredible innovation using blockchain to track supplies of medical supplies and building a blood container, a blood bank in a container. Today, we serve over 96 million people and work in over 2,000 hospitals, really solving this problem. But we don't want to stop there. Our goal is to reach the 1.2 billion people across Africa who desperately need good healthcare. You see, we believe at LifeBank that primary healthcare is the foundation of a healthier society, and that a healthy society can participate in the global conversation. And we know that solving this issue is absolutely critical, and making sure that innovation can reach primary health center at the last mile. So while our innovation already works in cities across Africa, in Nigeria, in Kenya, and in Ethiopia, we are yet to get to the last mile where most of Africa get access to health. Today, I'm excited to announce our new product called OneBox. OneBox uses predictive technology to ensure that supplies get to the hands of the hospitals in last-mile rural communities. The OneBox app uses historical supply data and sits on a predictive analysis to ensure that primary healthcare workers, like the nurse I mentioned earlier, are able to do a couple of things. First, imagine this nurse had updated our inventory a couple of days ago. And imagine that she tapped on the app and saw what she needed to order. And she had ordered it just 24 hours ago. And imagine that she has actually made that request and it's delivered into the hospital. In that moment at 3 a.m., she doesn't need to call anyone because what she needs is already right there at her hands. OneBox is already working in over 120 primary health centers in northern Nigeria, and we are excited to do more. This application is so simple to use. With just a few taps, you're able to update your inventory, get your prediction, and access to the supplies that you need. It's important to note that LifeBank believes that primary health centers are the center of healthcare. And if we're gonna solve this global challenge that COVID has shown us, we must build technology and place this agile, accessible technology into the hands of the people who matter the most. Thank you so much, and we're just getting started.